Okay, yeah. So, yeah, this patient presented with diarrhea and then developed renal failure and purpura. That's a hemolytic uremic syndrome. Can be caused by Shigella, E. coli, presentation diarrhea, lethargy, irritability, pallor, bruising, petechiae, oliguria, edema, hemolytic anemia, thrombocytopenia, increased creatinine, hematuria, proteinuria, CAS, increased bilirubin. Treatment, fluid, electrolyte, and we can go do blood transfusion. Last resort is 50%. 50% of HUS patients need dialysis. Okay, so if you are a 2-year-old boy with difficulty climbing stairs and there's 1+ patellar and ankle Achilles reflexes bilaterally, so both calves appear enlarged. So what do you do next step?
So I think you can do the genetic testing.
Yeah, smart, very smart. Then muscle biopsy with absent dystrophin. That's what you're gonna find. So there are there are difference between Duchenne, Baker, and myotonic. Myotonic
Mm-hmm.
is autosomal dominant due to CTG thionyl mutation. Onset of age 12 to 30. They have facial weakness, hand grip, myotonia, dysphagia, and they can have arrhythmia, cataract, balding, testicular atrophy, and death from respiratory or heart failure, depending on the age of onset. Baker and Duchenne both X-linked recessive due to dystrophin gene XP21. Only the severity is different. Duchenne is present at 2-3 years old, progressive weakness, Gower maneuver, scoliosis, cardiomyopathy, wheelchair dependent, and death by 20s, 30s. While Baker is 5 to 15 years old, milder weakness,
Mm-hmm.
but they have cardiomyopathy and death by 40, 50 years old. That's the difference. Now, sorry, if you are a 4-year-old boy with headache, vomiting, and the that headache that feels better after vomiting, so it's
Mm-hmm.
interesting. You got the idea, right?
Mm-hmm.
So what's next step?
I guess you're gonna have to do a CT or
Yeah,
MRI.
brain CT because it's intracranial, like mass or something. So if you're a 33-year-old George boy present with cyanosis and when you cry, right lower extremity is weak and hyperactive. So what are the greatest risk for this condition? You have morning headache, tonic-clonic seizure.
Oh, brain abscess.
Yeah, excellent brain abscess. A risk factor for brain abscess, there are direct spread if it's in the sinuses, like dental, frontal, ethmoid sinus, can cause direct abscess. But the hematogenous spread can be from bacteremia, from other sites of infection, so that's the difference. Now, if you're a 3-year-old boy with a freckle on the face and axilla and flat,
Mm-hmm.
uniformly hyperpigmented macule covering your back, abdomen, and extremities.
An F1.
Yeah, smart. So we gotta do brain and orbital MRI. Now, if you're a 4-year-old girl with hemianopia, hemiparesis, hemisensory disturbances, the skull X-ray shows tramline intracranial calcification. What's diagnosis?
Neuroblastoma.
Sturge-Weber syndrome.
Oh, Sturge-Weber syndrome. Okay.
Yeah, they have tramline intracranial
Oh, the
calcification.
one with that's the one with the port wine stain on the face. Yeah.
Yeah, yeah.
Mm-hmm.
So, if you're a 7-year-old boy, you stare for a few seconds and roll your eye for unknown reasons.
Mm-hmm.
What is the? How do you treat that?
Absence. Itosusumide.
So you roll your eyes for unknown reasons.
You roll your eyes.
Yeah. So if there's, you can give ethosuximide or valproate too. Can work
Valproic
for
acid.
absence seizure.
Mm-hmm.
Sometimes they don't give ethosuximide in the choice. So if you have cafe spot and freckle in armpit and groin, what is that?
Cafe au lait spots and what?
And freckles in armpit and groin.
Yeah, neurofibromatosis type 1.
Yeah, good job. That's a very tough condition. Feeding difficulty, short stature,
Mm-hmm.
learning
I know.
difficulty. If you're a 2-year-old girl with calcification in the renal area
Mm-hmm.
and a
So
decreased,
now that would be neuroblastoma.
yeah, neural crystal. Smart. Now, if you're a 5-year-old boy, we'll examine you if there's conjunctival injection, pain with extraocular movement. What is that?
Orbital cellulitis.
Yeah, it can be caused by bacterial sinusitis.
Mm.
Now, if you're a 3-day-old infant with copious purulent discharge from both eyes, how do you treat that?
So 3-day-old will be gonorrhea. So gonorrhea, you still give them the ceftriaxone.
Yeah, or cefotaxime.
Yeah, or cefotax. Yeah,
Yeah,
okay.
we diagnose it by gram.
Ceftriaxone.
Yeah, we do hospitalization on cefotraxone or cefotaxime. We diagnose it by gram stain of gram with gram-negative intracellular diplococci and
Okay.
positive culture on Thyre-Martin medium.
Mm-hmm.
Yeah, 2 to 5 days. Copious exudative discharge. What is the first thing you do when you deliver a baby?
Well, I guess you do the physical exam and then, check them out and give them so you give them vitamin K, you give them the ointment, erythromycin ointment
Yeah,
in the
so
eye.
first we do physical assessment, removal of airway
Mm-hmm.
secretion,
Mm-hmm.
drying the infant, keeping him warm,
Mm-hmm.
and preventative like gonococcal ophthalmia prevention and vitamin K supplementation. So that's yeah. How to manage OCD in kids.
Well, obsessive. Is it not CBT?
No, we
Cognitive
can give
behavioral
them
therapy? Or you can give.
fluoxetine. So
Okay,
there
is
is
that right?
something panda. Do you know what is panda?
Panda.
Yeah,
What is that?
it's a fancy condition. They call it pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection. So kids have streptococcal infection and develop OCD. So it's interesting.
Hmm.
It's low yield. I think it's low yield. Okay. Now, if you are a 16-year-old girl with a BMI of 15 and you fell in the shower, what should I do now?
You fell in the shower?
Mm.
So I guess this is anorexia nervosa. Fell in the shower, maybe is it osteoporosis? I don't know.
Yeah, so this
Treatment?
is there's the BMI less than 18, intense fear of weight gain,
Mm-hmm.
distorted. We do first CBT, nutrition rehab, olanzapine, if nothing worked. While bulimia nervosa, we do CBT,
And fluoxetine.
nutritional rehab, and SSRI. Yeah. Now, 2-year-old. If you're a 2-year-old boy who, and then you start banging your head against the wall when your mom refused to give you the toy, what is that? You always
Temper.
huh?
Is it temper
Let
tantrum?
me now. Yeah. Let me give you more clues. Okay, you have restrict. So the husband and the mom restricted the boy activity, keeps to himself, takes off his clothes that are not soft enough, speaks only when spoken to, appear indifferent to the presence of others, attempt to engage the child in conversation are unsuccessful, and
Is it autism? Autism
yeah, it's autism.
spectrum?
Yeah, autism spectrum. So it's multiple persistent deficit in social communication and interaction. Okay, currently or by history, involving social, emotional, reciprocity, nonverbal communicative behavior, and
Mm-hmm.
developing, maintaining, and understanding relationships. They have a restrictive, repetitive pattern of behavior. Okay, currently, right now, or by history. Repetitive motor movement like banging the head. Insistence on sameness, on inflexible adherence to routine. Uh, Fixated interest of abnormal intensity of focus. Adverse responses to sensory input. Symptom occur in early developmental period, cause impairment. Not better explained exclusively by intellectual disability or another condition.
Mm-hmm.
That is the thing. ADHD, the best thing we know, we do teacher evaluation to figure it out. Now, if you are a 2 day old infant with sneezing, tachypnea, diaphoresis,
2 day old infant. Okay, sneezing. Okay.
vomiting, loose stool, high pitched cry,
Mm-hmm.
what's causing?
Heroin.
Yeah,
Heroin.
heroin. So ADHD is more than 6 inattentive, more than 6 hyperactive symptoms. Okay, you have several symptoms present before age 12. Symptoms occur at least in 2 settings, home and school. There's functional impairment, social and academic, and there is different subtypes. So inattentive symptoms are not attention to detail, make careless mistakes, difficulty focusing games, tasks, reading, lectures, does not appear to listen to spoken stuff, cannot follow instructions, difficulty organizing tasks. Just a second, let me put IV access to my laptop. Yeah, no, okay. So ber- avoid requiring sustained concentration, usually misplaces stuff, easily distracted by stimuli, forgetfulness. Plus hyperactivity symptoms like difficulty staying seated, runs or climbs inappropriately, cannot perform activities, physically active all time, talks constantly, blurt out answers. So those sorts of things. Interrupt when others are busy or speaking, so these types of things. Now, if you're a 16-year-old boy who have blinking, grunting, grimacing,
16-year-old boy doing what?
blinking,
Uh-huh.
frequent blinking, grunting, grimacing,
Mm-hmm.
increased isolation, worsening academic performance.
Mm-hmm.
Yeah, how do you treat that?
So likely this is a Tourette syndrome.
Yeah, so this is
So you do,
Tourette. Mm.
I think you give them antipsychotic and also you can give them clonidine, right?
Yeah, it's for both multiple motor and one or more vocal tics.
Mm-hmm.
Like motor, facial grimacing, blinking, shoulder shrugging. Vocal, grunt, throat clearing, yelling. Onset before 18.
Mm-hmm.
Treatment antipsychotics,
Mm-hmm.
alpha adrenergic receptor agonist, and behavioral therapy.
Okay.
That's the treatment for that. So you can give them also pimozide,
Mm-hmm.
risperidone.
Okay.
Yeah,
What about
they prefer to
clonidine?
yeah,
What
first.
about clonidine?
Yeah, they prefer to start with clonidine, guanfacine first, and then you go for Risperidone and pimozidine. Now, if you're a 2-year-old boy with wheezing in the right lung field and the left lung is clear to auscultation.
Foreign body.
Wow, that is awesome. So you gotta do bronchoscopy, yeah, you're right. So foreign body, they have signs, history of choking, coughing, sudden onset, respiratory distress, cyanosis, altered mental status. Physical finding, you have focal monomorphic wheezing on affected side, diminished aeration on affected side, generalized wheezing, respiratory stridor, hoarseness, respiratory distress, and radiographic finding like hyperinflation or atelectasis on affected side, visualization of foreign body, those sorts of things. So if you're a 7-month-old boy with fever, fussiness, and decreased wet diapers.
7 months.
Yeah.
Okay. Boy.
Yeah.
With fussiness, what else?
Fever, fussiness, decreased wet diapers.
Maybe infection, likely UTI or something, I don't know.
Yeah, UTI, something like that. So you gotta do urethrocatheterization, urinalysis, urine culture. So if you're a 14-year-old boy with a 2-day history of fever, nasal discharge, incidental urine dipstick testing shows 2+ proteinuria, what do you do next?
Steroid.
Repeat.
Is that what you're asking?
Repeat dipstick testing on 2 subsequent occasions.
Oh, you're just talking about is it proteinuria or hematuria? Proteinuria, right?
Yeah, transient proteinuria.
Okay.
With an infection,
right.
Yeah. Just repeat it. How do you manage sodium of 165?
Hydration, IV fluid.
Yeah, just isotonic fluid, yeah. Now, if you're on microscopy, there's alternating area of thinning and thickened capillary loop with splitting of glomerular basement membrane in a 15-year-old boy with deafness and proteinuria. What is that?
Alport syndrome?
Yeah, obviously, that's an easy one. So if you're a 7-year-old boy with multiple fractures and bruises on okay, and so what do you think diagnosis?
Osteogenesis?
Yeah, they have blue sclera, hearing loss, and they have opalescent teeth. That's it. Dentage generous and perfect. So if you are if you are a 3-year-old boy and you lost all of your teeth at a very early age and you're complaining of deafness, what is that? Same thing, osteogenesis imperfecta. Recurrent bone fractures, you lose your teeth. So if you're a 15-year-old boy with with a mild left hip pain, bilateral anterior-posterior and frog leg lateral x-ray of both hips are obtained. Okay. And there's a slipping of the femur.
Mm-hmm.
in a 13-year-old obese boy.
Mm-hmm.
What's your diagnosis?
Skiffy.
Huh?
Scuffy or skiffy.
Yes, left capital femoral epiphysis.
Mm-hmm. Treatment is spinning, right?
Yeah, surgical spinning. Now, if you're a 12-year-old boy with on examination, the range of motion of the right knee is normal, but the hip movement are restricted, and the right foot point outward, and there is external rotation of the right thigh on flexion of the hip.
Mm-hmm.
So what's next step?
You need to do X-ray. Sorry, not X-ray. MRI.
So this physical finding, this is for slipped capital femoral
Yeah, it's
epiphysis.
scuffy.
So we do surgical pinning of femoral head.
You don't do imaging? Is that what you're saying?
No, they did it in tricky. Yeah, you do imaging obviously, but they did it in a tricky way that they didn't give you imaging in the search options.
Oh, okay.
Yeah, so this is the interesting way to say the physical finding.
Mm-hmm.
If you're a 3-year-old boy with decreased appetite, neck swelling, irritability, what should I do?
Decreased appetite, neck swelling.
Yeah, irritability. You resist passive flexion of the neck.
Yeah,
and
meningitis.
And rotation to the left side, huh?
Oh, is it torticollis?
Torticollis, yeah, X-ray of the neck we do.
Mm. And this is the one that you try to do, like think you massage it or something like that. Treatment. What do you do?
What do you think? What do you think is the best way?
I think they say like you do like a physical therapy where you massage it back, those muscles to relax back again.
What's causing that? What do you think?
What is causing it? I don't know. Is it something about the muscles, the sternocleidomastoid something muscles? Unless if the patient is okay, this is 3 months. Yeah. If it's like
it could be upper respiratory tract infection, minor trauma, cervical lymphadenitis, retropharyngeal abscess.
Yeah, I think they said it's massage.
Yeah, massage. But we have to do the X-ray just to exclude cervical spine fracture. That's
sure. Man, I'm sleepy.
Yeah, we're done. We're almost done. So now we gotta take consent for what minors we take consent from.
So if they are married, if they are in the military, if they like that, they have their own house or home, they're independent. If they have a child, and
homeless or high school graduate.
Okay, homeless or high school graduate.
Yeah, or medical emergency like STD, substance abuse, prenatal care, emergency care. Okay, so let's do a rapid review of whatever we discussed for today and then call it a day.
We're gonna finish this week, right?
I hope so, yeah. Not much left. Look.
Want to use next week to start doing like really dedicated study. I've registered for my exam.
Oh, nice. When?
End of the month. Not this month.
Oh, the one after?
Yeah, end of June.
Okay. Let's do a rapid review. Okay. So, chlamydia, we test for chlamydia in young females or sexually active. Kalman syndrome, they can't differentiate other. Hemolytic uremic syndrome, diarrhea with renal failure. Absent dystrophin in both calves enlarged, and weakness with climbing. Now, autosomal dominant is the inheritance for myotonic dystrophy. We do brain MRI if you have headache relieved with vomiting. D. George increased risk for abscess. Orbital MRI for freckles. Sturge-Weber syndrome for tram line intracranial calcification. Okay. Valproic acid for absence seizure. NF1 for cafe au lait spot. Neural crystal when there's calcification in renal artery. Bacterial sinusitis can cause orbital cellulitis. Cefotaxime for gonococcal. 1 dose you give them. Keep the baby warm whenever first time he was born. Neonatal abstinence syndrome is due to heroin. The risperidone is treatment for Tourette syndrome. Wheezing on the right side of the lung, that's a foreign body. We do bronchoscopy. Transient proteinuria, we repeat testing on 2 occasions. Normal saline for hypernatremia. Alport syndrome causes deafness and thickened capillary loop in GBM. Multiple fracture with type 1 collagen defect. Slipped capital femoral epiphysis. Management by surgical pinning. X-ray of the neck for torticollis just to exclude spinal injury, spinal cord injury. Okay, consent we take from homeless, parent, married, military, financially independent, high school graduate, emergency, STD, substance abuse, and prenatal care. And that is the end of the second part of pediatric. I think we left with 2 more parts and we'll be done with pediatrics. That's cool. It was shorter than I expected.